Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
Now let's see what are the root causes. Till the date, science has proven, some researchers, as per them, the root causes are decreased level of dopamine. We know there are lots of neurotransmitters inside the brain which secretes some hormones. So dopamine is one of them, which is really very necessary to stay mentally fit. Now decreased level of dopamine is one of the root cause. Dopamine, already we discussed what is dopamine in our previous video. If you check our reels, so we always we have the videos like how to increase the level of dopamine with the help of certain foods, fruits and some natural products which helps you to increase the level of dopamine. So when the dopamine level goes down, there is a chance to face the Parkinson problems. Some family histories. Yes, of course, till the date, researchers also shows a thing like those who have a family history, so hereditary you can say, they are very much prone to face the Parkinson's problems. Those grandparents, siblings, parents have faced the problem, they are very much prone to face at any age. Viral infection, sometimes due to some unrecognized viral infections, sudden Parkinson problem is arises. Antipsychotic drugs, those patients who are suffering from certain type of depression, anxiety, or you can say any type of psychological disorders, and from long period of time, if they are on medication, say more than 3 years, 4 years, 5 years, if they are on the same level of medications, so this type of antipsychotic drugs are also responsible for Parkinson disease. Genetic factors are there that we cannot change. Head trauma and environmental factors are also counted as a root cause. Now, head trauma, due to any injury, any accident, any sudden unwanted trauma which relate with your head, so there may be a possible, like in future, that patient suffers from Parkinson disease. Some type of environmental factor are also responsible. Now, what is environmental factor? Specifically, if I say the great scientists, researchers, like those who have to research for a longer period of time in zero gravity, that is the astronauts, due to longer period of staying at a different climate, different environment, their circulatory system, their neurological disorders are created, and because of that there may be a chance that they face the Parkinson disease. Like that, those who stays for the research in you can say very minus degrees, like North Pole or somewhere else, where the minus 70, minus 60 degrees are regular, that like a natural environment climate. So that lab technicians, those who are doing the research over that place, that environment, they are also prone to face the Parkinson disease in their future life. So these are some root causes that till the date we can count as in the cause for creating a Parkinson disease. Let's see, once the disease has happened, so what are the normal, you can say the symptoms of Parkinson's? Muscle movement related disability and movement. So basically, as we just say in the definition, loss of muscle control, one of the main thing. So what happened in the muscle movement, the symptoms when you are suffering from, the muscles become rigid, loss of grips, holding things, tremors as I just told you, bradycardia as we just talked. Whatever the muscle movements are there, they are affected. Maybe a right side of muscles, left side of muscles, wherever the part where the Parkinson's are affected in the body. So you can say physical muscle movements becomes lost completely, or they cannot hold the things properly. The muscle rigidity is created, can't move the proper way. Like see, if my hand move up to the 90 degree, 60 degree, 30 degree. But the patient's hand, those who are suffering from the Parkinson, their rigidity is created. They cannot move, the stiffness increases, they cannot hold and grip the things properly. So this type of problem symptoms are there. Posture problems. Those who have faced the problem of Parkinson, their vertebrae are mostly affected. Because of that, they cannot stand and sit in a specific posture for a longer period of time. Even in some cases, they cannot straightly stand and sit. Maybe the body posture is just like a bending posture or one-sided postures, bending. So this type of things are happening. Sleep disorder. So many reasons for sleep disorders. First of all, it's a, we can say, it's a progressive neurological disorder. Because of that, the sleeping pattern get disturbed. Second, as I told you, like these patients get irritated mentally and physically. Because of that, their sleeping pattern changes. Like if they have a sound sleep by the daytime, so they cannot sleep at the night. Sometimes if they have a good sleep at night, then the whole day they get irritated, discomfort, breathless. Sometimes they cannot sleep even for 2 or 3 days because they have certain type of pain, tremors, or whatever the symptoms that we can see in the cause. Because of this cause, they cannot get enough sound sleep at a period longer time. So this is one of the symptoms. Depression and anxiety. Obviously, because of some disability or the neurological disorders, they cannot cool and calm completely. First of all, physical inability. Second, mental irritability. Third thing, sudden this disease arises. Because of them, their movement can get stuck. They cannot move freely. They have to depend on somebody. Because of that, always they are under depression and anxiety level is always on a higher side. See, once we are healthy, we can do anything that we decide. We can do anything according to our goal and target in our life. But when you are dependent on someone else, when you have to completely depend on someone else, when the sticks comes in your hand, you cannot walk, you cannot balance yourself, then this thing definitely arises. Some negativity, some depression is always there. Like why it happened with me? Because it's a completely psychological disorder also. A healthy person gets stuck on a bed suddenly. So obviously we understood the psychological and mental status of that person, which indirectly or directly results into depression and anxiety. Plus some certain types of drugs or the medications going on, they are also responsible for the hyperness also. Dementia, again the problem related with memory and sleeping disorders. Swallowing difficulty. Sometimes if the Parkinson affects on a specific gland or near the organ, so in that patients they have the difficulty of swallowing. They cannot easily swallow the things. It will take more time. They have to give pressure on certain organs and then they can swallow the things. Speech problems are there, like if the Parkinson affects on the face or on the tongue, so they cannot talk, the speech problem arises. Because of that, they need some type of therapies and everything. They need to improve and recover the things, because we never know on which part of the body this problem arises. Male erectile dysfunctions are also one of the symptoms when the person, specifically the male, is suffering from this problem. They feel, like they are not able now in life with their partners, and so many other psychological and mental disturbance, plus along with the physical restrictions. So this is one of the main symptoms that they are facing. Now we already talked the different root cause and symptoms. So according to that, you can bifurcate the things. But still, there are, as I told you, like Parkinson is a progressive disease. So there are different forms of Parkinson's. According to that, we need to treat and understood the stage of the Parkinson.